Well, good morning, good afternoon, good evening, everyone. Welcome to our global forum. We appreciate your patience as we get the technical things worked out to get us started this morning. We are now live and we're excited to get started on our forum. And again, appreciate your patience as we get everything worked out. I'm Robert Waugh, a physician who has toiled in the health IT vineyards for over 25 years. I'm also a member of the VCI steering committee. VCI is the Vaccine Credentialing Initiative, and it's a coalition of 800 public and private sector organizations that came together in 2020 to solve the issue of giving citizens a way of displaying their clinical information like their vaccine status in a privacy protecting, secure way. We developed the open source Smart Health Card framework, which we'll be talking about today. I'm also chairman of the board of directors for the Commons Project. The Commons Project is a 501c3 nonprofit that sits between the private sector and the public sector, doing digital goods and infrastructure for the public that neither the public sector or the private sector can do. We put out Common Health in April 2020 as an example of this. So today we're here to talk about smart health cards. And I want to sort of level set everybody an understanding what we're discussing here. Essentially, a smart health card is a secure digital envelope that we can put clinical information into in a secure way that's privacy protecting, it's open source, it's free to the user, and it's under the control of the individual. To do that, we've built a complete ecosystem around the smart health card. So here on this diagram, you see the smart health card there that essentially becomes a digital or paper representation of the envelope. And what's inside the envelope is secure until it's verified and opened. That gives the individual the opportunity to have this digital or paper-based information on their device or on a paper form. And they can control who they show it to and how they show it. It can go into digital wallets, all of the major digital wallets in the marketplace today, except smart health cards. And so what makes this all possible? It starts with issuers. And on the left side of your screen, you see that the issuers are governments and providers and pharmacies and labs. We'll go into more detail about that during the session today. And then on the far right, we have verifiers, people that are verifying the information inside the secure digital envelope we call smart health cards. And we'll talk in great detail about the verifiers. This all sits on a foundation of a trust network, a registry of known users, so that the entire ecosystem understands that the information that is given to the individual that they're displaying is in fact from the correct source. So I just wanted to go through this ecosystem to make sure that you understand a little bit about how this all fits together, because it can be a little bit more convoluted than we sometimes realize. So in today's session, we're going to be talking more about each one of these components, the issuers, the smart card themselves, the verifiers, as well as the trust network that supports it. So this entire ecosystem will be the topic of what we're going to discuss today. We're really excited about the smart health cards because there's really been a huge uptake in this since we put it out there. Nearly over 150 million citizens today in the United States have access to a smart health card to display their vaccination status or their COVID status from testing. This is a huge uptake, and we're excited to talk more about that. We're seeing more people every day issuing them and more verifiers. We've put a free verifier app out in the marketplace, so anyone ranging from bars and restaurants can do it, but we also have an API where you can automate that verification process. So today we have put together, I think, an exciting panel of speakers, and we're very excited to get started on that. In the event, we're going to talk about first a U.S. government perspective coming from former and current officials from the U.S. government. We're going to introduce the smart health card and the importance of building a trust federation. And then we're going to talk with issuers from both government and the private sector on their success stories and how to expand the standard more broadly across the United States and the world. We'll hear then from governments and organizations that are verifying smart health cards and the importance of having verifiable health credentials for reopening after this pandemic. At the end of each 30-minute session, you'll be prompted to join the next conversation, so look for that prompt. And as the sessions go on, please submit any questions you have during the event using the question and answer function in Zoom. Any questions that aren't covered by the moderators will be followed up directly via email afterwards. We'll also send follow-up information for both potential issuers and verifiers after the event. So if that pertains to you, please stay tuned. So with that, I'd like to introduce Ryan Howells, who will moderate our next session. Ryan is on the VCI steering committee with me and is from Levitt Partners and the Caron Alliance. With that, I'll turn it over to you, Ryan.
Thank you, Robert. And again, welcome everyone to this session. We appreciate you joining. I would invite my panelists to turn on their screen, if they would, their video, I should say. And we're excited to have them here. I know we're going to have a few more of them join us here shortly. I want to introduce all of our panelists as they continue to join. We're going to have Andy Slavitt here, who's the former White House senior advisor. We have former Secretary Mike Leavitt, former Secretary of U.S. Health and Human Services and three-term governor from the state of Utah, and Rebecca Coyle, the Executive Director of the American Immunization Registry Association, or ERA. And we'll have Mickey Tripathi as well, the National Coordinator for Health Information Technology at the Office of National Coordinator at the Department of Health and Human Services. So Governor, why don't we start with you? In 2005, in the Bush administration, you were instrumental in helping develop the nation's first pandemic preparedness plan. You had also testified back in February of this year in front of the House Energy and Commerce Subcommittee about the need for an open source vendor agnostic digital vaccination credential that all Americans can show that they've been proof that they've been vaccinated. And at the time, you had discussed the need for more consumers to have direct access to the vaccination information in their state immunization information system, or IIS. How do you feel now that we're almost 2 years into the pandemic about the nation's preparedness or the lack thereof? And then how would individuals having access to their digital verifiable vaccination information help us return to some sense of normalcy?
Well, thank you, Ryan. As you mentioned, I was between 2005 and 2009 Secretary of Health, and I want to draw on not just my pandemic preparedness experience, but I also, like Robert, was a sort of trench fighter in the effort to move health information technology into an interoperable space. And I have drawn lessons from both those experiences for this one. The first, I would say, on pandemic preparedness, I spent a fair amount of time suggesting that the dilemma in a pandemic is that anything that you do to prepare at the time before a pandemic happens seems alarmist, and hence there's a reluctance to do it. And then anything that you've done after it starts is inadequate. And that's proving out here in a very real way. The fact that we are unprepared on this is a reflection of the fact that in our hearts we thought this would never happen, I suppose, because we put it off for other priorities. The fact that we are now 2 years into it and we're struggling to do it is a reflection of the fact that this needed to be done some time ago, but the need is still there. Now, could I draw for just a moment on my experience, like Robert, with health information technology and interoperability, which plays very much into this, and he's still there. This is a function of being able to do two things. One is, how do you develop standards? And the second is the question, what should the role of the government be? Now, I concluded in my experience that there were only three ways you could develop standards. The first is you could have the government just prescribe them. And my experience, and I think history tells us that's as well intended as it is, they probably get it wrong because it's too complicated. The second option is what I call the last vendor standing strategy, where you let people fight it out and try to, the truth is there's more ways to do this. And so what you end up with is no standard. And the last is you can go through a very deliberate collaborative process that's painful and hard, but it's exactly what the Commons Project and others are now are coming together to do in order to make this happen. And finally, I'll just say, Ryan, I think what we have learned in this pandemic is that this isn't just about pandemic preparedness. This is actually about protection of society and all the things that we care about. This is an economic policy matter. This is a defense policy matter. We should be investing in this all the time, every year, to get better. And we're behind the 8 ball here, and we have to begin to move forward. I congratulate all that are involved in this. I call upon the government to play its role. And in my mind, the government's role is not to operate this system, it's to enable this system. The government doesn't need to operate it. That's the source of people's concern, but the government has to enable it and organize it or participate in its organization. So Ryan, I broke into song over one question, but I had things I wanted to say.
That's outstanding, Governor. Thank you for that. And thank you for your leadership on this. This has been outstanding. I'll turn to Rebecca shortly. And Governor, we may come back to you here towards the end. But, Rebecca, before the pandemic, not many people had heard of this jurisdictional immunization information system. I know I had not heard this, or an IIS. But what can you tell us about what an immunization registry is and what function they perform? And then what's ERA's role in the immunization community, both nationally and internationally? And then we'd love to get your perspective on smart health cards and where you see this going in the future, how this could help everybody in terms of understanding their vaccination status for a number of different use cases.
Well, thank you, Ryan, and good morning, good afternoon, good evening to everyone. I'm pleased to be with you this morning, and I want to first take your first question about immunization registries and what they are. So you are not alone. There are many of, I think, Americans out there that didn't know that we actually had immunization registries in place. We have immunization registries in place in all of our states, many of the large cities like Washington, D.C., New York City, Philadelphia, some of our counties, and then also all of the U.S. territories and freely associated states are operating one in the U.S. So what is it? An immunization registry is just that. It is a registry of vaccines that an individual has had. It is consolidated into one record. So regardless of where somebody received a vaccine, maybe they received a vaccine in a mass vaccination clinic, perhaps they received one at a pharmacy, and there's a need for their physician to be able to see what record that person has. The immunization registry can deliver all of that information to the provider that's administering vaccines or caring for that individual seamlessly through interoperable mechanisms at the point of care. So I appreciate all of the work that has been done to get to this point. This has sort of been operating in the background for many years, but I think we're really seeing the true utility of it now as so many Americans are being vaccinated and need access to their immunization records.
Rebecca, let me just drill down on that for a second. One of the challenges that public health has had in the US for quite some time is just the ability to have continuous funding over some of the things related to infrastructure items such as IISs as well. Give us a sense as to how that hopefully is changing or evolving over time, or where you see this really needing to be emphasized going forward from the perspective of public health infrastructure, and to Governor Leavitt's point, this idea of an interoperable ecosystem that allows for you to have access to that vaccination information.
Well, I really appreciate Governor Leavitt's perspective on this. As somebody who's worked on the state side and at a nonprofit side, I think across the board, we see sort of the boom and bust of funding and how that is sent out to public health in volumes that you almost can't manage. And then as soon as we get through the crisis du jour, the funding goes away. And so it's really difficult to build systems that are sustainable with funding that comes in drips and drops, and then suddenly there's a lot and there's just no way to actually, I think, utilize that and invest it wisely. So I think there's absolutely a need for consistent funding to support an infrastructure so that when the next crisis hits, that we are all far more prepared than we are today.
Governor Leavitt, you've talked pretty extensively on this idea of a public-private partnership. You've led on this both in terms of your work in public office, but also in your work in the private sector. Can you just help us understand what that starts to look like in terms of, you had mentioned standard setting and this idea of gaining consensus, but give us a sense as to what that starts to look like in terms of how we most effectively work together as a public-private partnership to make this happen in the US.
A collaboration is hard work. It starts with good convening, and that has occurred. I mean, the fact that the Commons Project and others have come together, very important response to a need, and it has to involve common pain. And there's a lot of common pain right now. There's a lot of people who need, who have needs that aren't being met, and so that brings people together to collaborate. But if you talk about the public and private part of this, you don't need to go any further than just talking about the ISF, the state systems. They respond to different standards, and you know, if the Congress wants to take a lead and say there will be a standard and this is the process, but something needs to happen to make that a common set of operating systems so that the states can then be part of a federalist system that we're part of, that we have a federalist form of government where the states do have independence, but there needs to be a means of being able to bring those together. That's the kind of thing that the government needs to do. Only the government can do that. It's not possible. Otherwise, you end up in what I call the last vendor standing strategy, which is everybody competing to become the standard. Completely convinced that they have the best and only solution. Well, that's not true. It's not true in this situation or in electronic medical records or about anything else. And this is an ongoing long issue. But once the government has begun to enable that to come together in a collaborative way, just as Robert explained earlier, then we can begin to empower a marketplace who can take that information and figure out how the best way to deliver it to consumers, to compete, to find the best ways to access in a convenient way. Then you harness with the public side the best virtues of that system, and the private side with the best virtues of a system that works to take that information and to deliver it in the most effective way, and it blends. That's the beauty of a private-public partnership, and it could play out here and is, but it needs to be accelerated.
That's really helpful. One other comment on that, Governor, is that you know, obviously there's kind of a high degree of sensitivity about this concept of a vaccine passport versus a credential versus proof of vaccination. You know, we have always talked about in the work that we do together in the Caring Alliance about getting individuals more access to their own health information. Really, that's what this is about in terms of digital access. But give us a sense as to where you see this going in terms of what that means for an individual to access their own information and how that potentially could help us reopen the economy.
Well, there's always a question about who owns the data and the rights to access that data. But one thing is unchallengeable, and that is I own a right to have my own data and to have it in a form that I can present it conveniently for the kinds of things I want to do. And that's fundamental to this process. Having the ability to access my data in a way that is credible so that I can present it in a way that I choose. Now, this is not the government requiring people to do anything. It's the government enabling people to get information they own in a way that's convenient to them. It's the healthcare system providing that access. Now, we've broken new ground in our country about giving people access to their own health records in a form and in a fashion and in a timely way that they can do with it what they need. And it's making them healthier and it's making our system better. We just need to do the same thing here. We just have to be able to give people access to information they own, they control, they decide in a fashion that allows them and the market then to respond with tools for that.
Yeah, that's really helpful. Thank you for that. One of the questions I think that we got in here, Rebecca, is really for you, is this idea that, from a state IIS perspective, how does it really work today? In other words, can you talk about how it works in terms of states actually sharing immunization information with each other, so more of a business-to-business concept, and then talk about some of the newness associated with state IIS actually providing consumer access, and give us a sense of where that is.
Sure. If I may, I would like to just open this up by saying, the immunization information system community's underlying principle has always been collaboration. And I think that's truly where why we've been able to get to where we are today. So we have standards across our community that have been in place for almost 20 years and even longer in some areas. But I think what we often find are you can create a standard, but until you're actually measuring and ensuring that everybody is adopting those standards, you can have a standard, but nobody's there to check on that. But I think collectively, all of our states have worked really hard to really pull together and adopt the standards. And so I think all of that is why we've been able to share data with providers and providers with IIS. So as far as how that operates in the real tangible world, if you, Ryan, are going in to get a vaccination today, your provider will hopefully query the immunization registry from their electronic health record system. They will then get your vaccination history for you. They will also look to see if there's a forecast of what you may need, what immunizations are due. And then they will make the appropriate decisions based upon the discussion with you. They'll administer vaccines if needed. And then where that vaccine goes is into the electronic health record system. And then the electronic health record system transmits that electronically back to the immunization information system. The IIS then reconciles all of that and returns a new complete record and a new complete forecast for you as well. So this has been happening for many, many years in the background. You just often don't see it anymore because everyone has electronic health record systems and they just print it off and they don't know where the data is actually coming from. Behind all of this is that IIS. I think the other piece is that state to state. And so the other compounding issue is standards are fabulous. They're wonderful. But the other component is policy. And when you have a policy that says you can either do something explicitly or you can't do something explicitly, you have to modify your technology and your standards to meet those policies. So that is one of the challenges that we see currently with state-to-state sharing, is that every state has to sign an agreement with another state in order to be able to exchange that data. And it's a lengthy process. It involves a lot of legal folks at the state level, but we're moving in that direction. We're getting there. We have more work to do, but I would say it's because of the policy concerns.
And certainly direct to consumer access can avoid some of those legal challenges, right, that we have.
Yes, absolutely. And yes, you had asked that question as well. So absolutely, allowing folks to have access is, quite frankly, it's on a state-by-state basis. Some states have enabled that capability, so anybody can go in and look up their record and be able to take it wherever they want in paper format and now in the smart health card format. But it's not universal.
Governor Levitt, I'll give you the final word. Go ahead.
I'd really love to ask Rebecca a quick question, because it's obvious that the states are working very hard to implement this and to create standards that are meaningful because of the availability. Is there anything that you believe Congress could do that would make that easier? Or are there things the executive branch could do that would make that happen more quickly and more efficiently?
Yeah, I think there's a lot of gaps in terms of the policy side, and one of which is sort of that overarching framework for how IIS should operate, how each state should operate. I think there's a need for all providers to report. This is the first time COVID is the very first vaccine where all providers are required to report to the immunization information system. What that does is that helps give us a great set of data. It also makes sure that we have a record for an individual when they need it. Outside of COVID, it's sort of if a provider is obligated, or some states have requirements, but it's kind of a mishmash of policies out there for who's to report. So we collectively need a lot of assistance at the federal level to say, this is who needs to report and this is how you report.
If I could just say, if you think of our system of government as a group of PCs, they need a common operating system. And it's going to be difficult for them to come together and agree to that, but they could come together and then have the Congress begin to offer that as a standard, not make the standard, but facilitate it. Because in order to work like a network, you've got to have an operating system. And I think it's very difficult. So I think if nothing else came out of this, and I think a lot of things will come out of this summit, that message that Rebecca just delivered is a very important takeaway for policymakers.
Well, and we do thankfully have that standard and we do have that network. We just need some help at this point to make it most efficient.
Rebecca Coyle, Governor Mike Leavitt, thank you both so much for joining us today. We apologize for Andy Slavitt and Nikki Tripathi not being on the call. I think there's still some technical difficulties we're working out, but if they're able to join us later in the session between now and noon, we will definitely put them on as panelists. But thank you, Governor Leavitt. Thank you, Rebecca, as well. I want to turn it over to my colleague, Brian Anderson, for the next panel.